Hello class, this is a video to prepare you for the clinical setting of caring with a patient who has had an acute ischemic stroke. As you have learned in your readings, an ischemic stroke is caused by a clot that is blocking blood flow in the brain. Oftentimes, people that have strokes can be left with negative side effects, difficulty with mobility, speech, chronic weakness, and emotional instability. Some emotional side effects include depression, where someone can have periods of deep sadness or times of extreme anger. With proper rehabilitation and education, some patients can overcome these obstacles. Other times, the effects have created too much damage and the body will not go back to its baseline functioning. As a nurse, we need to know how to teach these patients and families how to cope with these deficits. After assessing the ABCs, airway, breathing, and circulation, we will assess for any changes in the level of consciousness, responsiveness, and orientation to a person, place, time, and situation. Can they respond verbally, or do they respond with nonverbal head nods? Some patients have limited language ability prior to the stroke. At this time, it's appropriate to ask questions to family and look at previous assessments to figure out what the patient's baseline is prior to the ischemic stroke. Another question to keep in mind during the assessment is, do they have voluntary and involuntary movements? You will check this function using a head-to-toe assessment. Some patients may be left with a weakness on one side of the body, which is called hemiparesis. There needs to be a passive range of motion of these specific extremities, as well as encouraging active range of motion with the muscles that the patient still has control over. Nutrition and elimination are other important factors to focus on. Patients with a deficit of dysphagia or difficulty swallowing may require different diet orders, such as one with thickened foods. Some patients may need to refrain from food until being evaluated by a speech and swallow pathologist. Some cases, patients will have feeding tubes. At this point, it is important to keep the head of bed elevated at least 30 degrees to prevent aspiration. For elimination, we will want to assess if the patient has continence or incontinence. If they can verbalize when they need to go to the restroom, we need to critically think of what is the best way to get them to void. Come up with a plan. Some patients need to use a walker. Some may only be able to use the bedpan. It's important to communicate these things with your patient so that they are more apt to work with you on these things. Sometimes patients can have transient urinary incontinence due to their confusion and inability to communicate needs. Sometimes the control of their urinary sphincter can be lost. If they are incontinent, we need to check frequently to keep them cleaned up to promote skin integrity and prevent skin breakdown. These patients can particularly become constipated. Therefore, they will need a high-fiber diet with adequate fluid intake. Overall, patients and families can become frustrated, emotional, and feel helpless. The nurse's role is to be supportive, provide positive feedback to patients, be patient, and give an attitude of hope and confidence to the patient. As you can see, there is much to think about as a nurse. It helps to put yourself in a patient's situation or view them in a perspective just as if they were a loved one you are caring for. I recommend trying to take a look at the big picture this week in clinical while having patients with neurological disorders. Try to critically think about the needs of a patient with a recent stroke deficit. Have a good day, and thank you for listening.